Welcome. Thank you for joining us. Michigan City Chamber of Commerce annual Inspiring Women event. My name is Katie Eaton. I am the president of the Michigan City Chamber of Commerce, and I want to thank you all for joining us today. The theme for this year's Inspiring Women event is Leading Through Change, and we have experienced many changes this year at the Chamber. We have reformatted many of our traditional networking events and programs to a digital format over the last several months, and this event is no different. The first time we are ever holding the Inspiring Women event in a virtual format. We wanted to keep this experience interactive, and so all of you as attendees should have received your attendee package. Looks like this great bag here. Has some wonderful items inside of it that will be talked about throughout the program. I encourage each of you to also take some time to view the digital program and agenda that was sent out to you in your emails. And I want to start things off by thanking our sponsors today for this event. Our title sponsor, PNC Bank, event sponsors, Economic Development Corporation, Michigan City, Franciscan Health, Michigan City, GAF, General Insurance Services, Harbor Trust Investment Management Company, Horizon Bank, Northwest Health Porte, Newby Lewis Cominci Jones, Northern Indiana Contractors Construction Agency, NICA, NIPSCO, St. Andrews Products, Solaire, Visit Michigan City, LaPorte, CVB, and Walsh & Kelly. Our title sponsor, PNC Bank, signed on again this year for their 10th year, even with this unique format. We thank them so very much for their commitment to the Chamber and to supporting women throughout our community and within their business. And at this time, I would like to introduce Sandy Smith, who is the branch manager at the PNC Bank here in Michigan City. And Sandy is also a Chamber board member. Sandy will say a few words on behalf of PNC Bank, and then she will kick off the event by introducing today's moderator. Sandy?
Thank you so much, Katie, for the opportunity to participate in today's event. PNC is committed to improving financial well-being for the individuals, businesses, and communities that we serve. With approximately 2,300 branches and 53,000 employees in 40 states, we deliver a personalized experience backed by the strength of a large and long-standing institution. Through executive leadership, strategic investments, and employee volunteerism, PNC is helping to build stronger communities. In 2019, more than $80 million was invested in the communities that we serve. The PNC Foundation forms partnerships with nonprofit organizations to advance mutual objectives driven by two key priorities: early childhood education and community and economic development. PNC Grow Up Great, a $500 million multi-year bilingual school readiness initiative, began in 2004. Research shows that the investments in early childhood education reap benefits for society and for the economy. PNC provides innovative opportunities that assist families, educators, and community partners to enhance children's learning and development. Since inception, PNC Grow Up Great has awarded $180 million in grants to organizations that support early childhood development, serving over 6.9 million children from birth to age 5. Through a progressive policy that permits up to 40 hours of paid time off for volunteerism, PNC employees have spent over 985,000 volunteer hours serving early childhood centers. In addition to our work in early childhood education, PNC is boosting the quality of life in neighborhoods through affordable home loans and lending programs, economic revitalization, and customized financial solutions. PNC Virtual Wallet, mobile banking app, and Cash Flow Insight are just a few of the examples of the tools that PNC provides. These tools allow clients to better manage cash flow while banking when and where they choose. Recognizing the differences in how men and women conduct business, PNC has trained and empowered a team of over 3,000 women's business advocates who are able to identify the unique challenges that are faced by women in business. These advocates work to connect women in business with the resources they need to achieve their financial goals and improve their well-being. It has been said that what does not challenge you will not change you. Many of us have faced new and unprecedented challenges that have caused us to consider and adapt to change over recent months. We are excited to participate with the Chamber in presenting today's panelists. Each has a unique story to share about their response to change and the growth that they have experienced as a result. It is an honor to introduce you today to our moderator for today's event. Works for NiSource as Manager of Operator Qualifications across 6 states. She launched her own consulting firm, IND² Consulting LLC, in 2017, focused on improving diversity and inclusion in the region. Her goal is to assist local nonprofits and businesses on improving relationships and services to diverse customers, attracting and retaining top talent, and building an inclusive leadership culture. She is a certified facilitator with the Cultural Intelligence Center and is currently working on gaining her certified diversity professional designation. Angie is very active with several non-for-profit organizations with a passion geared towards youth leadership and education. She is on the board of directors of the Unity Foundation of LaPorte County Career and Tech Center Advisory Board, and the United Way of LaPorte County, where she serves as chair of the board of directors. In addition, she serves on the board of directors for the Indiana United Way and is a member of several women's civic organizations focused on scholarship and mentoring. Angie has a Bachelor of Science in Electrical Engineering and a Master's of Public Affairs. She has recently received numerous accolades, including the Humanitarian of the Year in 2018 from the Michigan City Human Rights Commission and United Way's Volunteer of the Year for 2017. It is my pleasure to welcome our moderator, Angie Nelson Deuitch.
All right. Well, thank you, Sandy, and thank you, PNC Bank, for being the title sponsor again. We appreciate you stepping up to the plate year over year and your commitment to the community and the development of women. I would also like to thank all of the sponsors who, in these changing times, I mean, look at it, we're virtual, we're not in person, for stepping up to the plate and allowing the Chamber to continue to have this virtual luncheon with the theme, Leading Through Change. With this theme, it's pushed me really to reflect on 2020 and, what our new normal has been with COVID-19. Many of us have been impacted one way or another, whether it's at home or at work. I mean, I'm here in my home office. I know that many of us have persevered through some tough times with friends and family. As leaders in the community, sometimes we need to lean on one another to get through it. And I believe that continuing to have this luncheon will help us do that. So without further ado, I'm going to go ahead and introduce a group of dynamic women who have had to stand in the gap and make tough decisions this year that may have impacted not only me, but you, your children, and your businesses. So if you would take a look at your digital program, you can read more about them, because I'm going to keep the intros very brief so that you can hear more from them. So first, let me introduce Dr. Barbara Eason-Watkins. She's our school superintendent for Michigan City area schools. Brenda Temple, vice president and general manager of Blue Chip Casino. Jill Nygren, she's the vice president of clinical support and services at Franciscan Health here in Michigan City. And then we have Kris Pate, who is the executive director of United Way of LaPorte County. And first of all, I love all of these women, and I am so excited that they are participating on the panel today. So we're going to go ahead and get started. The theme of this year's Inspiring Women's Luncheon is Leading Through Change. All of you have seen or experienced the devastating impacts of COVID-19 in the community. And we know all of you have had to adjust the way you operate. In fact, we are now seeing a spike in LaPorte County and in surrounding counties around Northern Indiana. So I would like to start with you, Jill. You have been on the front lines from a healthcare community perspective. How have you and Franciscan dealt with the pandemic?
Thanks, Angie. Yes, these are definitely some unprecedented times for us. In healthcare, we're used to planning for disasters, for patient surges. We use our evidence-based medicine and we practice that frequently. We plan for the worst and pray for the best. But typically when things like this happen, it happens quickly. Something happens in the community, we're alerted, we gather our team, we open up our hospital incident command center, we get in our roles, and we have little time to think about it, and we just go into action. But with the pandemic, it was a little bit different. We all watched TV. We all saw what was happening in Wuhan, China, and then it moved to Europe, and then it moved into the United States. So we had time. We all sat and watched how overcrowded the hospitals were getting and that patients were being cared for in the hallways. We saw the exhausted staff working endless hours. We heard that there was not enough personal protection equipment to go around. And we heard that healthcare workers were becoming ill. And the most tragic piece of that, we saw the volume of people dying. So, as this was happening across the world and before it reached us, we had a lot of additional time to prepare. To follow the CDC guidelines, to watch for trends in the area, to look at what we needed and shortages we might have. But with this extra time to prepare, it was also, we had extra time to think and to wonder, what's going to happen to our hospital? What's going to happen to our community? Will we have enough beds? Will we have enough PPE? Will our staff get sick? Will they take it home to their loved ones? If the staff gets sick, will we have enough staff to care for the patient? So these were really some unsettling times for us that brought a lot of trepidation and a lot of fear. But along with that, it was also a time that we really had to prepare. I'm very proud of our staff. We really pulled out all of our disaster preparedness. We looked at our disaster plans, our surge plans, our triage plans. We stopped all elective procedures, all elective surgeries, and we took all of that additional staff and started training them and bringing them back on the inpatient units so that they were prepared if we had this surge of patients, that we had extra hands that could care for them. We were able to secure more ventilators and more beds and more additional supplies. But still, with all of that, our biggest concern was PPE, the personal protective equipment. We didn't know if we were going to have enough for our patients and staff. At this time, with everything happening across the nation, there was enormous volume of need for masks, gloves, and gowns, and the manufacturers just couldn't keep up with the demand. So we had to put a plan in place as well. So how do we conserve? How do we limit? Yet how do we make sure that our staff still has everything they need without being wasteful? So that was probably one of our largest challenges early on. As we were planning, I think we kept focusing on, we have to keep our guide star as our focus, which is whatever decisions we make, whatever we do, the patient has to be at the center and what's best for them as we go forward. And to make sure that we're always following our mission and our values. So as we did this, I will say even though this was a time of such chaos going on, it was also a time of such great pride as we watched our physicians and our care team just care for our patients with such dignity and compassion, really putting all of their fears aside and doing what they needed to do for the patients.
That's
we
awesome.
also saw how they cared for each other. It was so encouraging and supporting.
So, when you say that, so was there fear amongst your staff, or how were they, with everything that was coming out, with, the guidelines, the CDC, were there issues amongst your own team about fear,
Yeah, actually there were, and so this was new to everyone. COVID's new. We don't have a lot of guidance. We don't have a lot of experience with that. So we were following the CDC, but it seems like things kept changing every week. So we would go out, we would educate, we would say, okay, this is what we're going to do. And then with the advancements, each week the rules seemed to be changing, and they kept getting better and better, but that meant we had to communicate more frequently and more consistently with our team. That was one of the things I think that was one of the biggest important things that we did through this whole pandemic is, we had to do more rounding on the floors. We had to listen to them. We implemented daily huddles with the leadership team. We put out daily emails to the staff with regular COVID updates to them. And then we followed what our infectious disease physician guided us to do all along. There's fear, but don't let the fear overtake you. Lead by science is what he would keep saying, not by fear. Give them the reasons and the explanations of why you're doing what you're doing and when, and explain to them that things are changing as, where the advancements are changing. We've, in such a short time, if you look at the advancements that were made with treatments and testing and the guidelines, it's amazing.
So that back to March. So I'm gonna, Brenda, I want to have you join the conversation because everything was happening so fast back in March. And with the Blue Chip Casino, it's one of the largest employers. How did you react to what you were hearing, from the CDC and from the state? I mean, you were getting impacted and hit from from everybody. So how did you react back then?
Yeah, we were, Angie. In March, we closed Blue Chip. After almost 2 years of riding a huge wave of success, it all came crashing down. It was devastating, both emotionally and professionally. But I had this team of people that was looking to me for strength and reassurance. I had to lift up their spirits and make sure that they understood that Blue Chip wasn't going anywhere. Despite all the rumors and speculation out there in the community that we were closing for good and they wouldn't have jobs to return to. So it was a very hard time. I've got 1,000 people that work here upon closure.
Yeah, and Barbara, I will say this, social media, because I saw all of the posts that were happening from parents, from businesses, the schools, it was more about the school system and city government and what's going to happen. How did you have to take this all in back in March as well?
Well, initially, all of the school districts in LaPorte County worked together to review the COVID data, to share information, and determine the messaging that was going out to the broader community, because it was new to all of us and we were entering into uncharted territory, and we wanted to ensure that we worked together. Now I would say the state has provided a more informative dashboard of information, and we've been able to identify specific indicators that are in use.
Okay, so Jill, now that we talked about where we started, so what can you talk about or speak to now with the climbing numbers? What can we do today?
I think be consistent. Back when we had peaked several months ago, really the numbers of growth that we saw in the COVID numbers were kind of contained. Westville Correctional Center had a huge outbreak, which affected the inmates plus the officers. So when we saw our volume surge, I would say half of it was centered in that area. Now with this surge that we're seeing, it's in the community. It's not in areas that are contained. And we're seeing a larger volumes of COVID patients right now than we ever have in the past. And when we look at the prevalence rate and our positivity rate, where we are now, we're almost doubled of where we were with COVID patients being out in the community opposed to a few months ago. So we just all have to remain diligent. We have to wear our masks, when we're around others. We have to wash our hands, sanitize our hands whenever we can, and remember social distancing. Our community is counting on us.
So do you want to talk a little bit about your gift?
I would, thank you. So as we talked a little bit kind of about the fear and the science and things that are happening with this, we selected a gift. So if you look in your bag and take out this box from Franciscan, you will find in your box that we have a mug. And on your mug is a quote from Pope John Paul II. And I'll read it. It says, never ever give up on hope, never doubt, never tire, and never become discouraged. Be not afraid.
Thank you. Be not afraid. So thank you, Jill. So with that being said, I want to transition to you, Dr. Barbara, because I know that the schools have recently gone back to in-person learning, kind of a hybrid model. And I know that the decisions that, Michigan City area schools, that you're making have a direct impact, not only on students, but on parents and even businesses. So, what has been your go-to strategy and what changes have you made to reopen?
Well, thank you, Angie. From my experience in leadership, listening is my go-to strategy in terms of gaining the trust and support of key stakeholders needed to influence and accelerate progress. But listening alone just isn't enough. To be a great leader who inspires trust in others, you need to demonstrate that you not only hear them, but you get them. And that's demonstrated by your subsequent actions. People who serve the public or communities are often thought of as servant leaders. And the underlying philosophy is simple, that the main goal of the leader is to serve and put the needs of key stakeholders first. Robert Greenleaf, who was the founder of the servant leadership movement, has been quoted as sharing, "Only a true natural servant automatically responds to any problem by listening first." Thus, my gift to you, and feel free to look in your bags now, is a stress ball in the shape of an ear that's imprinted with the words, "Listen first." The act of listening is an important part of learning. You can get to the root cause of a problem, process the information, and either bring a new perspective to a pending decision or provide a better understanding of a situation to those you're engaged with. Something that you definitely need to be aware of is that people can definitely tell when you are politely patronizing them or actively listening. And active listening often entails questioning or clarifying to understand what is being said. This way is clear that you are listening and processing what has been shared. My initial efforts as a newly appointed superintendent in Michigan City involved the strategy of listening, and we focused on framing our district work after a listening tour across the schools and the community. The messages I heard after all of the meetings with parents and students and staff fell into three buckets: a desire to improve academic performance, provide program options such as gifted and talented programs and honors classes, and also focusing in on STEM and the arts. And most importantly for this community, to provide career opportunities that were viable for the local community, with students being better prepared for the workforce. Listening has also been critical to our work during the pandemic. Parent surveys indicated that some wanted students in a traditional model in our classrooms in our buildings. Others wanted students to start online, but not miss out on anything so they could transition back in the traditional school setting. And others simply didn't want students to return during the school year and wanted flexibility in scheduling so that an adult wasn't needed at a set time every day for live instruction. Thus, we had to provide multiple instructional options for our students and families in response to each of these needs.
Right. So Barbara, I know over the last several months, we've seen a lot of organizations that have stepped up for the students and the families. I've seen people volunteering, to provide food to families at local drop-offs and different things like that. Kris, I know that you have been a part of that. Can you talk a little bit about how the United Way has stepped up in helping the school systems, not only Michigan City area schools, but all of the schools in LaPorte County?
Yes, thank you, Angie. This has been a great time of seeing the community come together. We've all been really concerned about our students having to go through a virtual learning process, and many of them with parents that have to be away at work during the day. So, it's been top of mind for so many of how can we support them. And our community has so generously come together to help the United Way raise funds during this time. We've had individuals, companies, foundations that have stepped up and made donations. And recently we were able to donate almost $400,000 to our school systems and student mental health programs throughout the county to just help keep these kids supported and guided through this process. And now more than ever to support their mental health, because that's an incredible need right now.
Now, wasn't there also, we had a lack of internet or access to, computers, or what do we do in that regard?
So, I mean, hundreds of hotspots have been were paid for through the United Way fundraised dollars from the COVID funds throughout the county. Several school systems took advantage of this. We had Chromebooks that were added to the school systems to make sure that students had what they needed, laptops, docking stations for some of the teachers, even earphones for some of our students who have difficulty with hearing, social emotional learning supports. There were just so many things that we were able to do to help support the students right now.
All right, thank you, Kris. So Barbara, I know there were many other partnerships, so can you elaborate on some of the other partnerships that you've had also while students have been home?
Sure. Many of our parents are essential workers in the community. And once it was clear we were starting the year with remote instruction only, our parents called, emailed, and posted concerns on social media. We listened and we responded. And that involved partnering with the Boys and Girls Club and our own after-school program, Safe Harbor, to provide a safe, supervised learning setting for students to receive remote instruction from teachers, have meals and snacks, and be supervised to ensure that health and safety protocols were in effect. And I should add that these examples also point out that listening doesn't always have to involve face-to-face interaction in this age of digital media communication. Also, in terms of community listening and responding, Franciscan Hospital's Foundation provided 2,000 thermometers for our families to establish health-focused daily routines of taking the temperature of their children after listening to community concerns regarding the lack of thermometers in many homes. I would like to just say at this point that there are several foundational skills that leaders should have in order to be effective. I have found listening first to be one of the most valuable. Listen first and you'll never go wrong.
Awesome. Well, thank you. So I hope that all of you out there, attendees, I wish I could see all your faces, but I hope you see the common theme of how everyone is working together and partnering to make sure the quality of life of all our folks are, at the top or at the priority, top of the priority list for everybody. So what I would like to do now is kind of transition to you, Brenda, because listening to Dr. Barbara Eason-Watkins talk about our kids, the parents, and listening to the parents, Blue Chip employs many of those parents that, in the community, and you are one of the largest employers in Michigan City. You were shut down in March, you opened back up in June. How have you had to reinvent business operations just to open?
Well, you're right. Indiana Gaming Commission granted approval for Blue Chip to open in June. The rules that we were required to follow to open were obvious cleanliness and social distancing standards, considering the thousands of people that walk through our doors on a daily basis. So we had to put in place processes to screen both our guests and our team daily. But there were a lot of things that we couldn't do. We could no longer have valet parking. We couldn't have cocktail servers on the casino floor, no live entertainment, no buffet, and limited capacity in both our table games and slot areas. All of these were major blows to our operation. But we had 3 months during our closure to anticipate and work through and manage our new business model in operating this world-class resort with an emphasis on profitability rather than volume. There's some cards and dice in your bag. And so I'm going to cover one small segment of how we reinvented Blue Chip. And I'm going to speak to table games as an example of one segment that we reinvented with COVID-safe practices. Cards and dice are the tools of the trade in blackjack and craps, our two highest volume table games. Table games in a casino is driven by the number of hands that you deal per hour. In the pit, which is what we call our table games area, we were allowed to have 3 people at a blackjack table that normally seats 6 or 7. So there goes our hands per hour. And table games guests must remain masked at all times for both the safety of the guest and for the dealer that's right across the table from them. So there's no drinking or smoking. Table games is also a high-touch, labor-intensive environment. The dealer and customers handle cards, dice, chips, and cash. Cards are changed out every shift, and on the cards you see how often we change them out. It's actually noted what time, what game, and what date it was changed out. Dice are sanitized with every new shooter. Chips are washed and sanitized every single day. And dealers must sanitize their tables, chairs, and rails every hour or when the game dies, and wash their hands with every game change.
Wow, washing dice. That sounds, first of all, that sounds far-fetched that you have to do that so often, but we understand why. Jill, you know, with the hospital, we didn't really talk about it earlier, but what did you have to do differently? Brenda's talking about masks at the table, PPE. We saw that there were shortages everywhere. What have you had to do, differently when it comes to testing and PPE and things of that nature?
We had a lot of changes and things that we have had to do differently that have still maintained. But a couple of the biggest things that we did, one was outdoor testing. So, we're a hospital, our services are provided within our 4 walls. But knowing the COVID testing that had to happen and trying to reduce the risk of exposure in the hospital, we set up a testing trailer outside. So everyone was registered over the phone. They would call, they would register, they would give it time to show up, and it was a drive-through. They would come, they would pull up their car, come around, they would go, the staff would go up, they would verify their identity and everything they were between the windows. And then once that was all set, they asked them to roll down the window. They would swab them and roll their window up, and off they would go again. So really limiting exposure. And it actually was very efficient.
It was. I was one of the first to go through that, and I was negative, everybody, but Yay. It was a stressful experience, but it was efficient. Mm-hmm. We drove straight up. I mean, we were there within 5 minutes. I was done. So yeah. It was efficient.
Great to hear. Another thing that I had talked about in my time was the personal protective equipment. That was our biggest concern. So we really had to put a process in place to ensure that we were not being wasteful. So in the past, we had personal protective equipment everywhere. It was at all of our doors. We wanted everyone using it. It was on the floors. It was readily available. Well, we had to take control over that, and we had to make sure that we kept control over our inventory. So we collected all of our personal protective equipment up. We opened a storeroom that was open 24/7, and we distributed that PPE per shift, per unit, with what they should need for that day. And if they needed more, then they had to come to the store and they had to sign out and take it. And it really helped eliminate waste. And people were scared. In the beginning of all this, masks were hard to come by. There were no masks anywhere to be found or to be bought. So we were finding they were disappearing. So this was essential for us.
Thank you. So Brenda, let me ask you this question, because I know my sister, and I think my sister's out there probably watching, but she came into town and, worked from, we were working remotely and decided that we're going to come to the Blue Chip while she's here. So we actually came and we had our temperature checked and we did all that. But then I thought, about this, how did your employees react to reopening and what was going through their minds along with the management team and helping them get through that?
Well, we expected our volume to be less than 50% based on everything I've said from our pre-COVID levels. And obviously, we were not able to bring back all of our furloughed dealers and supervisors, if I just talk about table games. But it wasn't easy. We had to reassure these people and this team that we were creating a safe environment for them to return to. Then we had to motivate them to deal with guests that were very unhappy with all of the new rules. We had to constantly reinforce what we call Boyd Clean standards. And guests were angry over masking. They would become abusive. So at times it was us rescuing them from these guests that were just so angry over what was going on. And then we had to reassure them that they would have a job to return to next week. There's a lot of negative information out there. And I think the biggest morale boost that we found was information. It's kind of like Barbara was saying, listening, but letting them know that we were exceeding the company's expectations and what our plans were for opening other segments of our business. Now, we continue to operate Blue Chip with our revised business model. And despite operating at 70% capacity, which exceeds our company's expectations, we are just as profitable as we were prior to our closure.
That's good to hear. You have been a wonderful community partner, and I can speak to that from a municipal government perspective as well as a grant perspective. So we appreciate that. So Kris, I'm gonna kind of wrap up our discussion before we get to questions with you, kind of tying all of the industry together, the schools, healthcare, and now, from a nonprofit perspective. I want to, you to talk about how the community as a whole has stepped up to support one another.
Thank you, Angie. As we talk about leading through change, you just can't do that in the nonprofit field if you're not working together, in my opinion. There's been some great research that came out of Stanford University a few years ago about collective impact, and that, our world is so interdependent and it's so complex that it doesn't make sense for one not-for-profit to try to take on a need and solve that by themselves. We're so much more effective when we come together and work together, not only as not-for-profits, but also bringing in other stakeholders from around the community, business people, volunteers, people who need help, bringing everybody together so that we can learn together, we can vision together, what future do we want to create? We can talk about our best practices, what's been working, what hasn't been working, and gain ideas from one another. As we work toward those common goals, when we work together like that, we're just so much more effective. And so, not only are we more effective as agencies, as not-for-profit agencies, but the end result of that is that we create a more effective support system for people who need help. And that's all of our goals. So as we work together and we meet with our peers and we talk through how things are going, I think it helps us all achieve our mission in a greater way and be more aware and more accountable to how we're performing, and then to be able to learn from each other to just do a better job.
Yeah, Kris, what was the name of the, we had several restaurants that started providing meals. What was it?
It was called Meals to Heal.
Meals to Heal.
And yes, it was incredible that our local restaurants coming together, I think I can remember them all. It was Patrick's, Leeds, Fish Camp, it's on the tip of my tongue, downstairs from us, Fiddlehead, and then also the cafe out by the beach, and they all came together and they were providing meals to shelters. They came together even in our parking lot, giving out meals, delicious meals, I must say.
Good meals.
It was just so kind. In addition to everything else they were doing, they were there feeding people. Meals to Heals was a great name for that project because their kindness was very healing, I think, to people.
Yeah, and then when I think about feeding frontline workers and families. I know that there were several groups, and I know that we have some coming up here shortly, that we work with the food bank, the Northern Indiana Food Bank, where you had, all of the local shelters, many churches that have stepped up as far as providing, food boxes, as well. So we appreciate that. But I know one of the things that happened, and I'm going to have Jill kind of chime in on this. There was at some point, I remember Dean stating, "Man, there's a lot of food flowing to the hospital." What was going on there, Jill, with all the food that was showing up?
Well, I will have to say, as awful as this pandemic is, it brought out such a wonderful spirit of collaboration. I get emotional sometimes thinking about it, because the outpouring of support that this hospital received from our community was humbling. Food is only one thing. So the food, I mean, every day somebody was bringing us food, it seemed like, for the different areas and the different departments. And we were so grateful, and it was so wonderful. But when you look at the big picture of everything that was happening, we're like, okay, we're all working. We're getting a paycheck every, week. We appreciate the food, but we don't need the food. There's so much need in the community because so many people are not working. So Dean did reach out and ask, was grateful and said, thank you for the donation. But please, if you want to donate to the community, not to us. But some of the other things that were donated, I mean, early on, like we said, when we didn't have masks, I could not believe the groups that were out there making homemade masks for us when we had none, that we could give to our visitors to wear when they entered the building. And then we could give that for our non-clinical staff that were in offices that they could wear, so we could save our PPE for the patients. Blue Chip and so many others, gloves, masks, the schools, they were making shields for us, and businesses were making gowns. It was unbelievable the amount of support that came to our hospital in this time of need and crisis. So very grateful, very humbling.
Thank you. And there was one amazing thing that happened in your parking lot with some churches.
Oh, there was several amazing things that happened in our parking lot. We had church groups come when we were all on visitor restrictions, so people could not come in the hospital. They brought church services to the parking lot. They were there praying, they were there singing, they had megaphones. That was so beautiful. And then we had the emergency medical team come through and do a drive-through with lights and sirens, or not sirens, but lights coming through, just honor all the workers and acknowledge all of the patients that were in there struggling. It was beautiful, beautiful.
Yep. So again, the focus, the emphasis, we've all been coming together. Everybody's been stepping up. Kris, I know we talked, you talked earlier about, supporting the schools and, mental health. And I know you're working with many agencies that are supporting our families, but what else should we be doing during this time of change as leaders?
Right. Thanks, Angie. We've talked about leading through change during this time. And the first person we have to lead through change is ourselves, right? And when we talk about a sense of community, I talked about collective impact. It makes me think of how much that applies to our personal lives and how we need a group of people. We talk about our children needing a village. As adults, we need a village too to help us move through this period of time. COVID-19 has brought along with it a lot of loneliness, sadness, for some even depression, and our hearts grieve the loss of being able to hug our loved ones and our friends and go to some of the places that we love to go and enjoy some of the things that we enjoy most. It's been a really difficult time, and at the same time that we're missing out on all those things, there's a lot of worry about our own personal health, the health of the people that we care about, our financial situation, our jobs, so many things that, like Joe was talking about, the importance of not getting focused on that fear. So, you know, we've got to take care of ourselves. I know that social isolation is one of the most damaging health determinants. And so it's important right now that we try to keep a normal routine, that we try to stay engaged with our friends and our families and have meaningful conversations in whatever way works for us, and that we pay attention to what, you know, what our mental state is, you know, what brings us down. If social media and the news is a depressor for you and really kind of brings you down, then limit the time that you spend on that and stay focused on things that give you joy and uplift your mood and help you get through. One of my favorite quotes is, people need a vision to pull them through the pain of transformation. And so right now we've got to hold that focus in our mind of a better time, stay hopeful, and you know, think of the ways that we've grown during this time, maybe because of COVID, maybe in spite of COVID, whatever that might be. But that brings me to my gift. And so if everybody could just look at the bag that you have, on the outside of the bag, it says the giving bag. This bag is on a journey. Please help it on its way. Fill it with loving kindness while it's with you on this day. Create a precious memory with your family and your friends, then pass it on to someone else, so that its journey never ends. And so I want to remind everyone to share your gifts, whether it's something in a bag or just your personal gifts with the people that you come in contact with. And then to think about what could you maybe put in that bag and pass on to somebody else, somebody that you care about, or somebody that you think needs a little pick me up, or to know that somebody cares about you. I'm always reminded of the saying that if you want to have friends, be friendly, right? And so this is one way of strengthening the relationships that you have, but also encouraging other people to do the same. So as we lead through change, we have to remember to be the change. And like if they say in the airlines, put your own mask on first, right? So model that good behavior, take care of yourself, and pass on your special gifts to others.
Awesome. Thank you. Thank you, Kris. So Katie, I'm going to bring you back and see if we have any questions. I think there are a few questions that have been in the chat and Q&A that we could pass on.
Yes, definitely. Thank you so much. We are going to start with a couple questions for Brenda. One that she answered in the chat, but I'll go ahead and have her answer it for everyone. But the question was, as long as we continue to follow the guidance provided by the Indiana Gaming Commission and Blue Chip's process with Boyd Clean program, is that something, are you able to keep things open? So do you see another shutdown coming from the state was the question. So talk to that. And then we also had somebody that sent me a message wondering about the spa at Blue Chip. So if you could talk to both of those things, Brenda.
Well, okay, I'll answer the potential closing. You know, with all of the processes that we have in place, which I can tell you are rigorous, and we are rabid about masking here and people following the rules and social distancing. Our security team is on it every single day, and we police it not only from a guest standpoint, but from our team members. We have almost 700 people that work here. Our numbers of instances here at Blue Chip, we wouldn't be naive enough to say we don't have any instances of COVID here amongst our team, but they have been extremely minimal, and in almost all cases. I don't think we've had a single case that has been contracted here at Blue Chip, which tells us it's working. Everything that we're doing here at Blue Chip is working. So as long as we continue to follow the guidance from the IGC and from our company, I don't anticipate any closure. Now, the second one is spa. Our core business right now is gaming and keeping this casino open. The spa is a nice to have, but it's not a need to have. So I don't really anticipate the spa opening until probably the first quarter. I have my director of hotels as one of the attendees, and she's thinking rats, because that's one of her areas of business. And she really would like to get that spa open. But for right now, we're probably looking at the first quarter of next year before we take a look at the spa again.
Brenda, I'm going to say that some people are going to say that's your opinion is not a need to have. So others are like, yes, I need to have that. So so that you know, so we'll keep an eye out for that.
Okay, noted, Angie.
All right.
So the next person I'm going to jump to is Kris. Again, we had somebody that wanted you to restate your statement that you had about needing a vision. If you can re-emphasize that, state that again. And then also we had a question about as we begin to think of the colder months coming up and our homeless population and some other things, or even families that might have needs, where is the best way for the community to contribute during the winter as we move into the winter months?
Yeah, and I'll help with that answer as well as far as the homeless and families too.
All right, thank you. So the quote is, people need a vision to pull them through the pain of transformation. And that just brings to mind how when you have that picture in your mind, you know, that goal set before you, that it draws you toward it, you know, it inspires you. It makes you think about, how am I going to get there? It's my favorite quote of all time. I don't even know who said it, but I love it. And I know Angie will add a few things, but I want to say United Way is in the middle of our annual campaign right now. And there are many ways that you can help organizations that are helping the homeless, but one of them is through a United Way donation for the annual campaign. We support our Stepping Stone shelter, our Citizens Concern for the Homeless. We, throughout this coronavirus, have helped other shelters here locally with PPE and you know, other supports. So there's volunteers needed at the shelter. They have a really hard time getting volunteers to come and stay and supervise. So there's so many ways to help right now. And if anybody wants to have a conversation with me about that, I'd be happy to do it. Go ahead, Angie.
Yeah, and let me add that, you know, there are several agencies, you know, we talk about, I know last week with City Council, we talked about utility bills and things of that nature. You know, we have North Central Community Action Agency. We have, you know, the trustees' offices that are doing a wonderful job and stepping up. So, you know, there are a lot of ways and a lot of organizations that are trying to support, you know, the families that are dealing with, you know, unemployment, number one, dealing with, you know, just all of the different things that are impacting them because of COVID, whether a loved one can't work or is off from work. We have all of those things happening all at the same time. So I know we're looking at that. The United Way is still providing grants to organizations that are out there. You know, the soup kitchens are stepping up. You know, right now we're not in the winter months, but I think that because of the home team, I know that Maggie from Unity Foundation is out there. The home team, you know, that's a collaborative group that focus on, you know, homelessness. So I feel confident in all of the organizations that are participating. And I know that the cities are trying to step up as well with COVID CDBG funds. So I feel good about where we're at and that we'll get through whatever the next phase of this change is. So that's kind of where I believe we are as far as dealing with the winter months. Katie, we got any other questions?
Thank you both for the answer to that question. And I will also say that, you know, the Chamber has numerous nonprofit organizations as members. If you have a specific passion and you would like to figure out what organizations, you know, have programs that meet that passion that you have, or specific, you know, groups in the community that you would like to give back to, feel free to reach out to us. We will send out some information to the numerous networks that we have to get you in touch with the right organization to participate with. So this next question is really for anybody. Maybe we'll start with Barbara on this one. And then if maybe Jill would like to answer, or anybody else. Looking ahead, what is your organization doing to become more resilient as you move forward? So we'll start with Barbara on that one. to unmute yourself.
Okay. Well, we have really established some routines and protocols that we feel are important, not only now, but will be important in the future, because we certainly don't know exactly how long the pandemic will last and what we'll need to do. Our social workers and counselors have been reaching out to students and families to ensure that, they're getting the social emotional support that they need. And our high school has been really doing something, really positive, because for our high school students in particular, it's been very, very difficult for them. As you know, many of our seniors had to pass on many of the opportunities that they normally have. But this year, our school leadership team at the high school has been partnering with the police department, and they've been making porch stops. And they've been to over 350 families already, just to say, hello, how are you? Do you need anything? How can we be a better support to you? So we're just trying to keep everyone encouraged and motivated as we move forward.
Thank you. Jill, do you want to add to that? How has the hospital become, or what are things are you putting in place to be more resilient as your organization moves forward?
Sure. And thinking about this question, originally when everybody shut down, as the businesses were shutting down, the governor was telling healthcare as well, prepare for the surge of patients. So stop your elective surgeries, close down your elective physician office visits, things like that. Well, studies have shown as some time has gone that was probably more of a dangerous condition for us, for shutting down elective services and putting off care, opposed to taking the precautions of being safety, masking and things, and allowing people to come in. So one lesson learned from that, we really, if at all possible, do not want to shut down services again. Another area, it's been wonderful how fast telemedicine has now come up with this, so that we have options. Just like all the meetings are coming virtual, we can virtually take care of patients if they can't get into the physician's office or some of the specialties that are in the hospital that are more in demand, we can take care of that with telemedicine. So that will be a huge process for us and advance us into the future. Cross-training, a lot of staff is now being cross-trained in different roles so that they can help out as needed, and we can flex and vary a little bit more with that. And just our disaster plans are so up to date now with everything, and everyone is educated and aware and prepared. So we're in a good place now.
Thank you for that.
Oh, one other thing I was thinking too that has happened that has been a little bit different and kind of nice. And when we talk about collaboration, the hospitals, they've kind of been in competition with each other in the past, of what you're doing. We have all come together, and we're talking and we're communicating, and everybody's putting the patient first. We're sharing resources, we're sharing supplies when somebody needs something that somebody else doesn't have, and we're all working together instead of in competition with one another, which I think sets up this community very well.
Yeah, and I think that across local governments and also across the school systems throughout LaPorte County as well. Katie, I was going to say, I see a question from Dominique.
Yes.
And I'll try to answer that somewhat. It says, are there any resources available on how to develop equitable funding frameworks for disadvantaged populations in an effort to revitalize disinvested areas of our communities? That's a lot. That's a mouthful. Let me say this. I know from a Michigan City perspective that I'll say the Michigan City Economic Development Corporation, along with the Chamber of Commerce and with the city government, that, we are really trying to focus on community development. But I know from Mr. Hulse's perspective and the board chair that we've been talking a lot about diversity, equity, and inclusion. I know that United Way Worldwide is overlaying DEI into a framework. And I've been doing a lot of reading, in that regard as well. But Clarence has been sending me way too many. Mr. Hulse webinars and things of that nature, where we really need to take a look at, our local neighborhoods and how we put money back into those spaces. Dominique, first of all, thank you so much for the community garden and leading that effort there in Eastport. She's been doing this for a little while. She doesn't get the kudos, and she doesn't like people to do that to her, but I'm just gonna say thank you for doing that. But I think we need to do more of that throughout the community and figure out how to get more of our riverboat funding back into those local neighborhoods to develop additional opportunities for our residents. I know that we have something on the agenda for City Council for small businesses that did not receive any government funding from PPP or the emergency funding. So hopefully some of those things will pass here shortly so that we can provide assistance to those who didn't receive them. And most of those are small businesses that have many are, locally owned women and minority, businesses as well. So that's a long winded answer to a systematic problem that we've seen that I know that we need to change. So I don't know, Katie, if you have anything to add to that.
No, thank you so much for answering that. And Dominique, thank you for that question, for sure. It's definitely something that we continue to have conversations with our partners, with the city, as Angie mentioned, and especially with the Economic Development Corporation. The strategic plan that the Economic Development Corporation put out at the beginning of last year specifically talks to making sure that community development, economic development is happening in an equitable way. And I'm proud to sit on that board and be part of those conversations with Clarence and many community leaders in Michigan City as we continue to make sure that we are providing opportunities for all and in a way that makes sense for all. So thank you for answering that question, Angie. And then just one last question that we have, and then I think we'll probably be able to wrap up questions. And I'm going to maybe start with Brenda and really thinking about your operations, as you think about moving forward, operations manuals or procedures or HR practices that you've had to maybe implement that became new now. What are some of those lessons learned that you've had through this experience that you will put forward as best practices that might even benefit not just you as Blue Chip, but any business or organization as they move forward? What are some lessons learned that you might have?
Be flexible. If you put something in place, don't be afraid to change it. Because as Jill mentioned very early in this webcast, the information is changing constantly. I can remember before we closed, I had posters up saying that masks weren't effective because that was the guidance from the CDC. So that's just one example of things that we had to be flexible and think differently so we can change it. So are there a lot of lessons that we've learned and practices that we've put in place that will probably be at Blue Chip forever? Yes, I think there are. And we have a great collaboration amongst the GMs here in Indiana and with my own GM team. We have 29 properties within Boyd Gaming. So we were able to bounce a lot of things off each other and ideas that maybe we wouldn't think about with Blue Chip all by itself.
Thank you very much. Angie, I think we'll turn it back over to you for your closing thoughts, and then I will close things out after you.
All right, sounds good. So first, let me thank the Michigan City Chamber for having this event and allowing me to facilitate this panel discussion with my friends, Barbara, Jill, Brenda, and Kris. And thank you all again for sharing, how you're leading through these challenging times, specifically within your organizations, but also with, the people that you serve. So I didn't talk about my gift yet. So my gift is the nylon baggie. Life is like a box of chocolates. So I put chocolates in everybody's bag, but also I use these inspirational cards more so when there's something challenging or maybe a difficult discussion that you might want to have, or if you're just struggling with something on your own. I use these and people will tell you, I give these out in different settings, these pop-up cards. Mine is Life is Beautiful. The one that I have is Dwell on the Beauty of Life, right? And then my other one is Today is Going to Be a Great Day. So, you know, my goal in my gift is to make sure that everybody had a unique gift, number one. But I also wanted to make sure that the words on those cards inspire you to lead through change. So I'm going to end with that. Thanks, Katie and the Michigan City Chamber for having us here for the discussion and to keep the Inspiring Women's Luncheon going. You know, these are challenging times, so we have to adjust on the fly again. So thank you all for being here and taking the time out to listen to us here today. Thanks, Katie.
Thank you, Angie. And thank you again to all of our panelists, Brenda, Barbara, Jill, Kris. So appreciate your willingness to participate in this event, even in this unique setting. Inspiring Women is definitely one of those programs, one of those events that we do every year that we did not want to lose out on this year. And you guys have exceeded my expectations of how inspiring you all can be and how well, you know, a different format can still work. So thank you so much for your participation. I would also like to just take this time to thank a couple other people that were part of the planning of this. Julie Krause with Patrick's Grill and Catering, and Megan Johnson also with Patrick's Grill, who put together the inspirational video that you all received a link to in the email that went out to you earlier this week. Please take a look at that. It talks to and shows images of all of the things that our community has done to come together even during these hard times. So it's very inspirational. So take a look at that. And thank you to Janelle, who is our operations here at the Chamber of Commerce, just for everything that she does. She's we're a duo here, just the two of us, and we don't do anything alone. So she has definitely been right by my side to make sure that this got accomplished today. So thank you so much to Janelle. And then thank you again to PNC Bank for being our title sponsor again this year, and to all of our event sponsors this year who help us not only during these types of events, but throughout the year. And I want to just say, you know, have a safe weekend. We're heading into the Halloween weekend. I'm sure there's some activities that are planned. Be safe.